Welcome to my world, the world of a medical laboratory scientist. Health is wealth, knowledge is power. Today's topic has to do with vitamin D association with autism and diabetes. When we talk about vitamin D, we are more or less talking about something that has to do with the muscles and other aspects that it affects. But the muscles, in terms of how calcium helps the muscle to excite it to perform very effectively. So when you now have a situation of where there is a lack of vitamin D, then you can ascribe whatever. You can even think ahead of what could be affected, and what could be affected would be in the region of the metabolic activity of that muscles, because the heart itself, every part of us that functions, that works, has to do with muscle. So the vitamin D has a problem because to get vitamin D, usually you need the sunlight. But baby in the womb, do they have sunlight? No. But the placenta, the mother's vitamin D, helps a lot to make the baby survive. So there are certain findings that has now been found that women who have diabetes before having children are prone to probably have autism spectrum disorder. The autism problem, which is one of the problems that the health minister or secretary in Donald Trump's regime is promising that within 8 months they will find the cause of this rise in autism. So one of the suspicious aspect is this diabetes before the pregnancy. So if a woman is diabetic before pregnancy, there is a chance or that association of developing an autistic baby. The other aspect is also the vitamin D itself, its role in diabetes is all that I shall be looking into in the slide section. So if you like the idea, this idea as it is right now, press the like button, subscribe, and move with me into the slide section. Thank you. The outline: objective, introduction, research findings, lab diagnosis, and conclusions are exactly what I shall be discussing. The objective: to expose the research findings that associate vitamin D with autism spectrum disorder and vitamin D role in preventing prediabetes condition from graduating to diabetes. The introduction: vitamin D is a fat-soluble vitamin that plays a vital role in the absorption of calcium for bone formation and muscular activities. It has also been discovered that vitamin D inadequacy reduces serotonin concentration in the brain by decreasing the synthesis of tryptophan hydroxylase 2, thus impacting the structural and neuronal writings of the brain. And autism spectrum disorder is a neuronal problem. Vitamin D comes in two main forms, D2 and D3. The D2 is from the plant source like mushroom and yeast, while D3 is from the animal product and is also produced by the human body in response to sunlight exposure. Autism spectrum disorder is a neurodevelopmental disorder characterized by repetitive, restricted, and inflexible patterns of behavior, interest, and activity, as well as difficulties in social interaction and social communication. These are exposed in Wikipedia. A WHO report 2019 specifically estimated the worldwide prevalence of ASD to be 1 in 160 children. Very serious. In the United States, the prevalence has increased from 1 in 59 children in 2014 to 1 in 54 children in 2020. This increase may be due to either improved surveillance and diagnosis or a true increase in prevalence. It is estimated that 10 to 20% of ASD cases are attributed to genetic causes. And if we are very current, we'll discover that the Health Secretary, Robert Kennedy, has really taken this as a challenge that he has to overcome to really prove that this ASD is man-made, suspecting that it could be the vaccine, but there are other reasons that people are now presenting. Hopefully, before the end of this year, we should be able to confirm the causal relationship between vaccines and other factors put in check. Yeah, in order to really show the association of pre-diabetic and vitamin D, I shall be exposing perhaps some of the strongest evidence of a significant benefit of vitamin D supplementation as seen in reducing the risk for pre-diabetes advancing to diabetes, as detailed in a systemic review and meta-analysis involving individual participant data from 3 randomized controlled trials by Peters and colleagues. Obviously, if the recommendation of that research are adhered to, then diabetes may reduce in prevalence, morbidity, and mortality as well. The complications of diabetes are so many, but if one can prevent that metabolic syndrome from going haywire to now establish as serious diabetes, then one is going to be saving so many lives. Now to research finding. Let's look at vitamin D association with autism. The introduction of vitamin D at much earlier stage during the prenatal period may also be associated with a lower risk of ASD. That was a research finding where a cohort study of 4,334 individuals were done, and the autism odd ratio was found to be 2.42 at 95% confidence level. So that really proves that if you introduce that vitamin D very early, it could remove the outcome of autism. In general, it was observed that improved vitamin D status significantly reduced the autism severity. However, the effect was not consistently different between the treatment and control group. The variation in vitamin D dose protocol and the presence of concurrent intervention might provide an explanation for the variability of results. The age of the child for introducing vitamin D intervention was identified as a possible factor determining the effectiveness of the treatment. So it's so important that conclusion that yes, it should be introduced at that very early stage prenatal period. Yeah. Furthermore, the brain needs basic substance to be well formed in the womb before neonatal life threats. In the womb, the inadequate supply of these quality substances or micronutrients surely results in this research finding below. Compared to an adult, the young brain is profoundly metabolically active and is responsible for approximately 60% of the total body energy consumption. That's research 11. It is well established that early nutrition is critical for neurodevelopment, rendering it a cost-effective approach for the prevention of mental health problems. Deficiency of key nutrients at critical period, including protein, long-chain polyunsaturated fatty acid, minerals such as zinc and iron and vitamins, endless, can compromise brain function due to their role in signaling cascade that affect the neuronal functional capacity of that unit. Yeah, on pre-diabetes and vitamin D. The study of Peters and their colleagues showed that vitamin D supplementation at doses higher than the recommended daily allowance reduced progress to diabetes in adults with pre-diabetes by 15% in the intention to treat analysis. The results were reflected in the 2024 Endocrine Society Clinical Practice Guidelines on vitamin D for the prevention of disease. The guideline recommendation stated that for adults with high-risk pre-diabetes, in addition to lifestyle modification, we suggest empiric vitamin D supplementation to reduce the risk of progression to diabetes. Of note, the trial informed the recommendation primarily included adults with high-risk pre-diabetes and dosage ranging from 850 to 7,500 international units, with the estimated weighted average daily dose of vitamin D supplementation of 3,500 international units. Yeah, the laboratory diagnosis comes in very handy so that the toxic level, when it's too high, vitamin D could also be checked, and when it is too low. So you need to use the laboratory often, as well as confirming whether one is in the pre-diabetic stage as a person. So serum sample is collected for vitamin D analysis. The values are listed. Where there is severe deficiencies, the value you will get mild to moderate deficiency and optimal level. But when it's toxic, possibly you find something greater than 80 nanogram per ml, and that is very instructive. You can do the conversion by multiplying with 2.5. That's the conversion factor. For pre-diabetes blood, or you collect blood or plasma, the fasting blood glucose should be for those in the pre-diabetic stage 100 to 10 to 125. That's borderline. Everything should be around borderline. OGTT should also reflect something within 5 minutes of 110 milligram per deciliter. Glucose challenge test also, a 3 hours test, they must come down to 140 microgram per deciliter from 1 hour after drinking glucose, 180 and so on. Then the HbA1c test, the pre-diabetes should be in the region of 5.7% to 6.4%. Anything higher is diabetic. Finally, the conclusion. The association of vitamin D to autism is even noticed that children suffering from severe autism have a deficiency of vitamin D when tested. So it's as if the autism itself is strongly associated with vitamin D, which severity reduces with vitamin D level correction, and the causation could even be confirmed that by the time you give vitamin D and improve the vitamin D level in that child, the autism severity reduces. So the causal relationship is just a matter of time before it is universally accepted. Vitamin D role in the elderly diabetic patients that were given more than the recommended dosage showed less complications of the diabetes. You will see a kind of less complaint. Since vitamin D is so useful, a regular check of its value is recommended. Pre-pregnancy control of diabetic level is also recommended throughout the period of pregnancy. We must understand that vitamin D is also something that affects the neural tube, that is nerves, and once it is indicated that it might even be affecting old age, the dementia, onset of dementia and co. So, but I will do further studies in that direction. So let's continue to watch my video for more information on health, because the knowledge of health keeps you staying healthy for a longer time and probably also help in longevity. The video, if you like it, press the like button, subscribe. There are so many videos for you to watch in this my YouTube channel.